The distribution chain, it looks pretty similar for Pfizer and Moderna. We'll get to that in just a moment. But first, part of the battle here is safely shipping the vaccine.
The issues is how we can maintain that temperature for the distribution from the manufacturing sites to the administrative sites.
Bahar Ali Akbarian specializes in smart packaging, using technology to track the condition of products en route to their destination.
Right now, all the vials for the vaccines, they don't have smart sensors in order to be real-time monitored.
But the shipments will be scanned, both as they leave the factory and once they arrive at a hospital, she says. In the meantime, the distribution chain for the vaccines will be closely monitored. Pfizer's factory in Kalamazoo is sending vaccines to hospitals or facilities with ultra-cold storage. Moderna will start by shipping vaccines to a hub in Texas, with the first delivery of 100 million doses promised by the end of this month.
All the healthcare facilities, hospitals, and pharmacies, they are trying to buy these ultra-low temperature freezers.
Dry ice sales are booming right now. It's needed to transport the Pfizer vaccine. The state's Department of Agriculture and Rural Development says the state is not anticipating any shortages of dry ice. But a second expert at MSU explains we could see changes in the supply chain.
Dry ice is often a byproduct to the ethanol industry, and there are many industries that had to throttle down during the height of the pandemic. So there might be some concerns there. But so long as the prices themselves reflect the increase in need for these dry ice products, I have absolutely no concern that ethanol producers or dry ice supply chains will be able to distribute and serve that need.
If you're curious about when you could get vaccinated, pay attention to the 4 stages provided by the state health department. First up is frontline healthcare workers and people in long-term care facilities. Next, some workers in essential and critical industries. Then people at high risk due to underlying medical conditions or anyone 65 years of age or older. And phase 2 is expected to happen this spring. That's the mass campaign to get all adults vaccinated.
Now, if you don't fall in those top 2 or 3 groups from the state health department, expect that it won't be likely until March at the earliest that you could get your shot. If you are curious to see exactly, well, roughly, I should say, where you stand in line, you can check out a tool. The New York Times has it in its opinion section. You'll just be prompted to enter your age, where you live, and your profession. Now, here at Henry Ford Hospital, we're told that staff here is expecting its first shipment of the vaccine for frontline healthcare workers at some point either today or tomorrow. We're live this morning in Detroit. Jen Shantz, 7 Action News.